Okay, class. In this section, we're going to talk about the skin. Not going to spend a ton of time on this particular tissue because you're going to learn a lot more about skin and the wound healing process later on in integumentary content. But I do want to make sure we cover the basics as well as the wound healing process, which is really more in regards to skin because it sets the template for healing in other tissue. We'll get into later on in this lecture. So again, here's a kind of a diagram of skin. So the integumentary system is formed by the skin and its derivative structures. So we've got a picture here. We have this as a reference in the reading materials for this week. So the skin is composed of three layers: the epidermis, which we have there. Get my where's my pen? There we go. We have the epidermis here, the dermis, and then the subcutaneous level. The outermost layer, the epidermis, consists of a specific constellation of cells known as keratinocytes, which function to synthesize keratin, a long thread-like protein with a protective role. The middle layer, the dermis, is fundamentally made up of the fibril structural protein known as collagen, which we talked about kind of extensively in the previous unit. The dermis lies on the subcutaneous tissue, or also known as the panniculus, which contains lobes of fat known as lipocytes or adipocytes. So the thickness of these layers varies considerably depending on the region on the body, right? We've got thicker skin on the soles of our feet versus like our face, for example. The eyelid, for example, is the thinnest layer of epidermis, measuring less than I think 0.1 millimeters. So the dermis would be the thickest on the back. So it's about 30 to 50 times as thick as the overlaying epidermis. So again, it's different depending on the location. The epidermis is constantly turning over. And again, it's where we also have, within the skin, our sebaceous glands, which secrete sweat and stuff to keep us cool. So the skin's crucially important for thermoregulation. And again, it's just as an intro. So next, we'll kind of cover the phases of wound healing. So wound healing is a process by which the skin, or really any injured organ, repairs itself after injury. The main aim of wound healing is to prevent or limit further damage, to clean and seal the wound against infection, which we've covered in previous units, and to restore tissue strength and, if possible, tissue function. Wounds in the skin can either be classified as epidermal, which is like shallow, which the dermis remains intact, it's not exposed or damaged, or a deep wound, which the dermis is damaged and is sometimes referred to as a full thickness wound. You'll learn different stages again later on, in the curriculum, but just introducing those concepts now. So wound healing is natural physiological response to tissue injury, involves a complex interplay between numerous cell types, cytokines, mediators, and quite often the vascular system. The three general stages of healing, we have our inflammatory phase, which is kind of the acute phase, the reparative, and then the maturation phase or remodeling phase. We can also break this down into acute, subacute, and chronic. Now, the initial injury, when an injury occurs, there's an outpouring of lymphatic fluid and blood, and then we set off the coagulation pathways. So both the intrinsic and extrinsic are activated to attain hemostasis, which again, to prevent any blood loss. And this occurs within seconds to hours. It's almost immediate. You've probably experienced this cutting your finger. You have, initial, release of fluid and blood, and then you start seeing your blood eventually starts to clot and to kind of protect that area. The inflammatory response is activated, and both leukocytes and thrombocytes release more mediators and cytokines to bring in more of those inflammatory cells. Now, it's important to remember that the inflammatory phase or the acute phase, essentially begins with hemostasis. Like once hemostasis occurs, that's kind of when the inflammatory phase begins, and that inflammation is largely beneficial to tissue repair. We often have this kind of warped view to a certain degree of inflammation. Inflammation is necessary, sets the stage for all the repair processes necessary for tissue. It's excessive or persistent inflammation that's problematic, right? So that's again just a little bit of caveat there. So the inflammatory phase or the acute phase, this where we have the formation of a fibrin clot at the injury site, vasodilators are released, including histamine, serotonin. We talked about some of those earlier on, which allow for a greater infiltration of inflammatory cells, macrophages to kind of start cleaning up necrotic or debris, and then proliferation of the capillary endothelial buds and fibroblast proliferation to start forming this kind of granulation tissue, which we'll talk about later on. So these fibroblasts begin their early matrix synthesis in this phase, and they start really kind of, it starts getting remodeled in the next phase here. So basically the inflammatory phase, everything's kind of drawn to the area and things start to begin, and that's followed by the reparative phase when we start fixing things. So the proliferative, or also known as a granulation phase, it doesn't really, again, occur at a discrete time per se. It's kind of ongoing. This takes a little bit longer than the first few seconds, but it's kind of a constant process and leads into our final phase. So the proliferative phase can be divided into 4 phases itself. In shallow, like I said, in really shallow wounds, this might not even occur, like revascularization and granulation if it's a really shallow wound. But revascularization, again, new blood vessels are formed, supply nutrients to the wound. Granulations, you have those fibroblasts, which were attracted, start laying down this temporary extracellular matrix comprised of collagen and fibronectin to kind of create this initial mesh to protect the area, start forming the closure of the wound. And then reepithelialization. So again, we start seeing the reformation of the epithelial layer, and then contraction. So we think this occurs simultaneously, but in a certain sense, like there is a slightly different phase. We start kind of closing the wound borders until they're completely closed and sealed back off. So once we finish the reparative phase, like the epithelial layers of the skin, right, should be kind of closed back off. And then we move into the maturation phase, or the chronic phase of healing, where we're remodeling, right? So now the wound's been healed, and we're starting to proliferate and return the skin to its normal character. And again, depending on the severity of the wound, like this may look different. Again, you'll learn more about this later on, but just remembering that that's a continuum, right? That phase of wound healing occur over a continuum. So here's a nice little diagram showing the phases of healing and like kind of how quickly it occurs, right? Over the intervals of times it occurs within, shows the different stages, and the relative kind of actions that occur. So it's a good thing to kind of maybe keep handy for you, maybe on your clinicals. As well as, here's a nice one to have as well too, the connective tissue healing time. So for different types of tissue, we have skin, which we just covered. We've got everything down there to fascia, muscle, tendon, ligament, bone. You've probably seen it. A meme of this that's kind of, or an infographic that looks similar to this. Just like that most of these are coming from animal research, which is we often use to kind of like investigate healing, because we have similar healing timelines depending on the animal. What's not listed on here is articular cartilage. That can be, we'll talk about some of the issues with articular cartilage healing later on. That can take as long as 2 months to almost 2 years to repair. Articular cartilage heals very, 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 very poorly. So again, this is a great resource to have. Just even in clinicals or on practice, giving yourself rough timelines for how things heal. And with that, we'll end here with skin and the phases of wound healing. And next, we'll move on to tendons.